feel like I'm failing her. I feel like I'm failing her, and I'm trying my best. I'm not a medical professional.
But David Witta has had little choice but to become one.
I got you. I'll always protect you, okay?
Chronic short staffing in long-term care, he says, puts his mother Thelma at risk.
I have to make sure that I'm there every single day for my mother at this point in time.
Understaffing, just one failure outlined in today's report. The pandemic's deadly toll in long-term care homes exacerbated, it says, by systemic shortcomings and deliberate decisions.
We have a history of issues not being addressed in a timely way.
Poor infection control and too many residents in a room allowed COVID to tear through homes, the report said. It also found the government of Premier Doug Ford, who once promised an iron ring around long-term care, was slow to act. And its pre-pandemic decision to stop proactive inspections of homes misguided.
The responsibility to stand and defend and to change this system, absolutely. That rests with me.
But Ontario's long-term care minister repeatedly deflected any blame.
We didn't start the fire.
While there have been decades of neglect, that response isn't good enough, says this advocate.
There hasn't been really, a lot of ability to the ministry to change the sector. And that's going to go forward unless there's a really big change in the way that the government is dealing with this.
The government has promised more hands-on care, but it balks at harsher penalties for homes breaking the rules.
If the government refuses to fine failed nursing home operators, as the Auditor General suggested, then it'll be up to voters to hold this government accountable at the ballot box next June.
Witta tries to hope, but has little faith left in the system.
I need to see action. That's the bottom line.
Until then, he's taking action himself.
Love you, Mom.
Ellen Morrow, CBC News, Toronto.